There was a girl as early as like primary 5. She was about 13 years. She had an abortion. She inserted some thing in her cervix, some concussion in her cervix, and then we have to refer her to Boga Hospital. And in those days, you could refer about 3 or 4 abortion cases in a month, because they said there was somebody who was somewhere who was giving them the concussions to drink, and then they also collect some to insert, and then others abort. Others don't also abort, they come here with complications. So that was how we saw that the situation was really out of hand. Because in a month, if we could refer about 4 to 5 cases of abortions to the hospital, and all of them teenagers, and all of them 2 school children, we saw that the situation was actually critical. So as ADEP came in, we went to the schools, we were telling them about family planning. We're also telling them about abstinence. We're also telling them about the hazards of the abortions. Maybe after the abortions, how you may not be able to deliver again, or you could even die in the process. And then they were also, because they were also peers, they could talk to themselves.
Since this club was founded, it has been of a good help to the students a lot. The students themselves have been organizing programs such as debates, such as role plays to educate their colleagues in the school here. And one of the things that they normally talk about most is about this HIV and STIs.
What do you mean by STIs, or what do you understand by STIs?
Sexual transmitted infections.
What are the causes of sexual transmitted infections?
It is mainly caused by sexual intercourse.
We all agree that STIs are preventable. But is it all STIs that can be cured?
No. Why?
Because HIV/AIDS is one of them and cannot be cured.
Please, who can explain gonorrhea, our understanding?
Gonorrhea is one of the STIs and STDs. When it affects you through sex, for female spouse, it's very difficult for you to identify the symptoms, but for male, you can identify it within 3 days. Through urination, you can feel pains around your abdomen, and other symptoms can follow, like urinating. After urinating, you see a whitish fluid coming out of it.
In case somebody is affected by STIs like gonorrhea, what method or procedures can the person take to cure it?
I think the best solution is to go and seek medical attention. And when you get there, don't try to hide your sickness. Like you, a boy, don't say, my head is paining me when your penis is paining you. Just voice it out, and the doctor will know the true sickness and give you the right medicine.
We invite them periodically, all the peer educators in the various schools, periodically. Every quarter we invite them for review meetings where we sit together and discuss issues that have taken place during the quarter, and then plan for activities to be done during the following quarter.
The first phase of the project, which was implemented and run from 2007 to 2009, has come to an end and has yielded fruitful and encouraging results.
So at the end of the 3-year period of implementation, one of the things we can actually talk about, achievements we can talk about, is adolescent friendliness of the facilities.
The adolescent health program has really helped them to interact well with us. Like, we wanted them to know that this place to be like adolescent friendly, and really it is, because when they have problems they look for us, and that is very encouraging. They know where to go, unlike before they were like, maybe they wouldn't even report.
When we came to this place, it wasn't easy to get the youth
especially the young girls. So when we started this project, we were able to capture the young girls, and then we have been educating them on the dangers of all these diseases, the early pregnancy, dangers of early sex and all those things, whereby we are now in good interaction. They have been coming to us at any time they want here.
I took over in January 2010 this year, and during our review meeting, we normally review the performance for the past 2 years, and I really saw that ADEP was doing a remarkable work in the area of adolescent reproductive health, because during our reporting we realized that we had 15 peer educators, comprising of 10 of them were students, and then the 5 were masters or teachers. And it really went a long way to reduce the